would like to give you a couple of technology reminders so that we all are, on the same page when it comes to the group norms and group practices. 1 second, let me. Okay, so you're requested to keep your videos on the gallery view so that you can see everybody, and therefore I had requested you not to join from phone unless it is really unavoidable. It's always good to join from laptop so that you can see everybody and you can interact also with everyone. Please keep your device on the mute mode unless you are speaking or unless you have something to say. After you have finished, please go back to mute mode, because otherwise there can be a bit of interference. Keep your video on throughout the session. Again, unless it is really unavoidable, then for a few minutes, in case if you switch off, it's fine. But keeping your video on will keep you engaged with us. And also I will be able to see who all are there. And then naturally, I'll be interacting more with people who are visible to me. So I would always, request you to keep your video on. In case if you're moving or changing your place, then you please stop your video, because then it causes commotion and disturbance in the group. For those few minutes, you can stop the video and, settle yourself. Whatever, you want to ask or say, use chat box. That's a good idea. And a lot of questions will be asked. So you will be, it'll be good if you, participate by answering in the chat box. You can rename as per your preference, whatever you like to be called. If you want, you can, rename according to your preference. And the whole idea is that it's more like a live on-site program. So imagine that we are in a classroom. So the kind of participation we would have, the same kind of participation I'm expecting in this program. Some more, group agreements that I would request all of us to follow. Please speak for yourself and be mindful of others. So sometimes what happens, we have a lot of experience. So we kind of, start talking about things that could actually hurt others or offend others. So please be mindful of others. And especially in all groups, we have, mix of group, doctors, nurses, paramedical staff, trainers, and quality professionals. So naturally, each one of us will come with some background, some experience, and our own follies. So we got to be mindful of everyone around us. A lot of discussion will happen during these sessions. So you're requested to maintain the confidentiality. Sometimes people may come out with the name of the hospital or name of a person, which I normally discourage. But in case if something of that sort happen, we are supposed to maintain the confidentiality and respect for the group and not to discuss that name and organization outside the group. Then please, for your for being engaged and being attentive and active participation, keep your phones on silent mode. Only if it is very urgent, you can take it. Otherwise, I would say you can actually avoid taking the call. Otherwise, it will interrupt the flow of your session. Then everyone has experience communicating, and we are all here to learn. So the idea is, of course, to share your experience, but the idea is also to learn from each other. Whenever we are giving feedback or commenting, let's focus on these strengths. Be specific and non-judgmental, because if anywhere we pass comment or something that hurt others, it would be not taken in a good taste. So trust is earned, and it takes time. So with all of you, I have interacted with most of you, I have interacted earlier. So we have built rapport. But with some of you, I'm meeting for this first time. Similarly, you are meeting each other for the first time. So slowly the trust would develop. So we got to really wait for that to happen. So these are a couple of the rules that I would request we follow throughout all 10 sessions where and I'm sure this is going to automatically happen, but I just thought that I must reiterate one so that all of us are on the same page. So moving further with this session, I think we'll have a small introductory session where we introduce ourselves. So what I would say, you need to tell about your name and the organization you are working with, and where you are based, because some of you may be, like we have friends from Bangladesh and somebody from Bangalore, somebody from Delhi, somebody from Haryana. So please tell where you are based. And also, if you could like to tell something about your name, something that you value about your name, whatever you are comfortable sharing. So maybe I'll do the beginning so that we set the ball rolling, and then I will pass on the baton, and then you have to pass the baton to the next person. So if I introduce myself, I am a psychologist and a trainer and an author in this field of healthcare for like good 30 years. I am founder director of Indian Institute of Healthcare Communication, something very new, something very niche, completely unknown to the healthcare industry in India. But then, fortunately, I am getting wonderful response. I'm hoping in the time to come we will be able to jointly bring some change in the system and society. I've done around 2,000 programs by now across the country with a lot of medical colleges, hospitals, and various other places. I'm a regular guest faculty to Maulana Azad Medical College, where I am working with the final year students and the postgraduate students working on their communication skills. So there we get students in the batch of say 35, and we do a 6 hours program for them, helping them understand how do you go about opening your dialogue with the patient, how do you collect information, how do you share information, how do you break bad news. So all those things we are doing in those 6 hours. It's a very a new initiative, but for the last 10 years I am working with MAMC, and we are regularly doing this program, and other medical colleges are also now taking initiative. Simultaneously, I am organizing a lot of programs independently, like this master trainer program. This is 5th batch in a row. I started this program somewhere in December. Honestly, I wasn't very sure if people will be really willing to take it, but you will not believe the post that I had put on the LinkedIn. It received 70,000 views, which is very, very rare. Something I did not expect. Around 1,300 or 1,400 comments, and more than 500 registrations for the program. So, I mean, I'm so thankful to the, to Almighty and to all of you to have actually given such a huge reception to the program. And recently I have authored a book. Some of you may have seen it. I think some of you have seen the book. I just share the screenshot of the book so that you have an idea what this book is. And then, sorry, I'm so sorry. This is the book that I have recently authored. Yeah, I have it in my hand also. I can show you this. So this book came into existence just because I am working with the medical students. So I had a feeling that we really need to come up with something that is, directly useful for medical students, which they can use as a handbook, more like a handbook. And how do I deal with the patients who are, very clinging kind, who are very anxious or who are very demanding, or how do I, strike conversation with the elderly patients with the special needs. So I have tried to, touch upon those areas in this book for the medical student. But this book is useful for one and all, and anybody, would be benefited by reading this book. So this is in brief about me, about my name. My name, as it says, it's Indu. So in Hindi, Indu is like moon. So what I feel about my name, the special thing that I feel about my name is that like moon, I like to spread peace and comfort to people around me, to and coolness to people around me. This is what I feel. This is what I understand from my name. So from here, I pass the baton to Dr. Deepak Singla, if that's okay. I would request you to introduce yourself and also tell something special about your name.
Yeah, greetings from Delhi. I'm Dr. Deepak Singla. I'm a pediatrician by profession and now drifted into administration and quality. I'm managing a hospital, Maharaja Agharsen Hospital, Punjabi Bagh and Dwarka. And I met ma'am long time back. My name is Deepak, and in Sanskrit, the word is lamp, which means a source of light. So that is what I think the aim of a doctor or a human being is, to spread light wherever we go. I thought that should be good enough.
Wonderful.
Thank you.
Thank you so much.
Thank you.
Yeah. Thank you. So whom would you want to pass the baton?
Okay, ma'am, this is Mehdi from Bangladesh. Is it audible?
Yeah, we can hear you. Yes.
Okay, this is Mehdi from Bangladesh. I am serving as a senior restaurant manager, admin at Epic Healthcare, first ever ISO accredited lab in Chittagong, and number 4 in Bangladesh. Besides my full-time job, I am passionate about blockchain development. So after my job, I am spending time there, and I am happily married, and I have a kids, only one daughter. And I am very honored that we are here to learn, and after learning, and maybe we can practice it in our organization. Thank you very much.
Thank you. So whom do you want to pass the baton? Who should be introducing? Okay, I think I'll do this. Dr. Richa, may I request you to introduce yourself? Yeah.
Hello, everyone. Good evening to one and all. And as I told, okay, I'm Dr. Richa Thaman. I am a professor in physiology at SGRD Medical College, Amritsar. I am Deputy Dean of Postgraduate, and I am a FAMER fellow and faculty, if you have heard about that fellowship program of medical education. And I'm a faculty, and I have come here to CMC as a faculty for the on-site FAMER fellowship program. And I've joined Dr. Indu's program. I have told initially also that I have online, I met her and we talked several times on WhatsApp, and I've been thinking of joining her program, and I bought her book also. It's a very nice book. Please buy it and read it. And I've myself conducted communication skill workshop for students, actually. For students also and faculty also, both UG and PG. But this is not my whole time job or profession. So I felt fascinated that Dr. Indu had made it a part of her mainstream job. So I just wanted to learn how she brings about this 10-week program about communication skill. And my name is Richa, and Richa are the hymns of the Rig Veda, and it means the first rays of the sun. Yes.
Thank you. So whom do you want to nominate to introduce after you?
Who I can see, NC Mohan, advocate. Yeah.
Wonderful.
You probably chose me because I'm the only odd one out.
No, I just saw your name in front.
Okay,
so
thank you. Thank you. Good evening, everybody. I'm an advocate practicing in Bangalore, Karnataka, India. So I've been practicing for the last 25 years. For over 20 years now, medical law has been my specialty. I met Dr. Indu Arneja in Mumbai. We were together in a mediation workshop. I found her to be a very nice human being, more than anything. Very humble, very nice, very approachable. And I've been in touch with her, and I also bought her book, which is right here. Like Dr. Richa said, all of you must buy this and read this. It's a very good book, and it speaks about so many things which you already know, but you haven't thought of, right? You haven't really given thoughts to those points. And this book is an eye-opener, and it paves way for you to pay attention to certain aspects in patient care. Whenever I go and I give talks, one of the most pertinent questions that my clients and my hospitals and doctors ask is how to avoid litigation. So I tell them that the best way to avoid litigation is to have a good interpersonal communication skills. So since this program is all about this, I thought I should also participate and learn more about these things in order to propagate these things to other doctors and improve my own skills. Thank you, Dr. Indu. Thank you.
Thank you so much, Mr. Mohan, for joining the program. I mean, I'm really surprised actually the way you showed interest for the program. I didn't expect that you'll be joining the program, but I was really surprised and very happy to know that you were very.
No, my pleasure, ma'am. My pleasure. I feel honored to be part of this.
But it's going to be a great learning for all of us also, because especially medical professionals, they really struggle with law. I'm sure you'll be able to throw a lot of light to help them understand how they can actually take advantage of this and learn from it and make sure that they don't get into wrong position when it comes to law. So it will be a lot of rich learning for all of us, I think, understanding law and also how do we really go about making sure that we don't go wrong on law. Thank you so much for
I am sure I'm going to speak about it, but I cannot be as sweet as you are, ma'am. I am a very curt critic.
That's okay.
I will try and contain myself.
Truth is always bitter. Truth is always bitter, and we are
Yes,
open to learning.
yes, that's the point I'm trying to make. Yeah.
Second thing is, this program is all about facilitation. So we are going to
Absolutely
focus a lot on how do you say even bitter things in the right manner, so that it doesn't.
I need to learn myself. That's why I'm here.
Yeah, we are going to talk a lot about it. Don't worry. Thank you so much.
Thank you so much. Thank you.
So whom do you want to pass the baton?
Dr. Sheetal Dixit.
Okay, Dr. Sheetal Dixit.
Thank you.
Thank you.
Good evening, one and all. I think it's an amazing platform here. We have people from all, like a 360-degree healthcare kind of whole bunch here. So thank you very much, Dr. Indu, for organizing this program. My name is Dr. Sheetal Dixit. I'm an anesthesiologist by profession. I'm also a simulation trainer, and I've been training on ACLS and ATLS courses for the past 10 years, which are simulation-based courses. We do a lot of communication skill training for them as well. This is for theoretical medical knowledge as well as we try to teach them how to sort of communicate, teach students how to communicate with their patients as well. I'm also a principal professor with the National Accreditation Board, and I am faculty with CIS, Data Institute of Social Studies in Mumbai. And one of the little aspects that we do is little communication training. So interestingly, Dr. Indu, one of my students did her little project in this regarding breaking the bad news and how what are the challenges that doctors actually face. She actually did a whole project on it, and it is surprising that more than 65 to 67% of the people felt that the doctors felt a little uncomfortable during breaking the bad news, and they did not really know how to go about it. So yes, I would like to learn a lot from this entire group. And ma'am, you are like the stalwart. Your book is just amazing. I have just bought it, so I'm trying to read. And I think you brought out certain aspects so well. My name is Sheetal. I try to be the cool one, but not really like my name. I tend to get a little anxious as well. So I would also like to improve my communication skills because I love to teach. Thank you so much, ma'am.
Wonderful.
Over to you.
Pleasure having you, Dr. Sheetal. Pleasure. Thank you. So just 1 second before we move further, I can see some, Dr. Azad, you already are already there, but there's another request from your side. And there's one more. 1 second. Has somebody joined from 2 devices?
Actually, I tried from mobile phone first of all, and then I'm now connected through laptop. That's why it should too.
Yeah, because even now I can see, one extra this thing. Who is
mine? Actually, I'm somewhere else, and there is some problem with connectivity, not at home.
Okay.
So that is why I didn't have. I thought maybe I'll just switch one of the devices off, and if I'm not able to connect through the laptop, then I will switch to the phone.
It's okay. It's okay. As long as it doesn't disturb, it doesn't cause any echo, and it's okay. It's perfectly all right. Okay. Thank you.
I can see the name, Dr. Rajesh Talwar twice in the participant section.
Yes.
Yeah, I joined from 2 devices since I am using my hotspots for using my laptop. So I'll disconnect because it's lying somewhere else. So I'll switch off from the my mobile.
So it's okay as long as it is not causing any echo. In case if it will cause echo, then you'll have to log out of one of the devices. Yeah. Okay. So can I request Dr. Sheetal, whom do you nominate to introduce after you? And Dr. Sheetal got logged out. It's okay. I think I'll request Dr. Puneet Gupta to introduce. Please go ahead, sir.
Yeah, good evening, everybody. I am Dr. Puneet Gupta. I am a vitreoretinal surgeon by profession, and I'm practicing at Ghaziabad. I have my own center. My practice revolves mainly around vitreoretinal surgery, which is considered a very difficult and complex treatment of very complex disorders of retina. The main reason I'm joining this and looking forward to a lot of discussion is how to deal with these complex and poor prognosis patients. Even if you do good surgery, good anatomical results, sometimes the functional results are not up to the expectation of the patient. And how to convince, and I have been in practice for the last 25 years and doing surgeries, but every time, I mean, when you do 10 surgeries, in 2 cases, you may have results which are not expected online. So these are the issues that come to my mind, and that's the reason why I have joined this program, and looking forward to have a very fruitful discussion with all of you and Dr. Indu with you. And my name is Puneet. I think Puneet is Pavitra. That's the thing I just wanted to say. Thank you. Thank you.
Thank you so much, Dr. Puneet. So whom do you want to nominate after you?
I think I can call Dr. Rajesh Talwar.
Yes, Dr. Rajesh Talwar, please go ahead. Dr. Talwar, you will have to unmute your device.
Yeah. I am Dr. Rajesh Talwar. I am an anesthetist and working with the RG Stone Hospital at Rajouri Garden, Delhi. I am heading the department, and I am there since last 12 years. Total, my anesthesia practice is for the last 32 years. And nowadays, I felt interested in psychology, and I did my bachelor's and master's in psychology, just completed in clinical psychology. I met ma'am as one of my counselor in with my problem, and my problem was solved very promptly by ma'am. And now that ma'am has started with this course, I felt it is very important for us as a medical personnel, as an anesthetist as well, to deal with such patients, to communicate rightly with them, to avoid any of the problems originating from miscommunication between the patient and the doctor. And more so, we feel that in our surgeries, if we fall short of any of the patient's mortality or something, then the patient's attendant, that they become aggressive, and then we have a lot of problems we face. So nowhere we are taught like how to communicate with the patient. So I found that it is the right time that I should take up this course, and I think I'll be benefited out of it. Rajesh, Rajaon ka Ish. That's what the meaning is. And I'm putting it in Delhi, in New Rajendra Nagar. And right now, one surgery is going on. That's why I joined late also, session in between also. Sorry for that.
That's all right. I completely understand. Thank you, Dr. Rajesh, for joining the program and having faith that we'll be having a fruitful discussion. I'm sure we'll have a lot of interaction here. So whom do you nominate after you?
Vijay Kumar.
Hello, everyone. Good evening. And thank you, Rajesh. I know you would nominate me because myself and Rajesh, we were in another different topic and different course actually, which is cyber psychology. So myself, actually, I am a technologist. I had a 25 years of corporate experience specifically into infrastructure and information technology. Later, I converted into psychologist. I did my master's in psychology, and of course, because I found that technology is there, but more than technology, we need to understand the human behavior, and that is how I got the passionate. And I did my master's in psychology, and now I became, I quit my corporate job and I started my freelancing, both counseling as well as trainings, corporate trainings, soft skills trainings. And of course, the recent thing is cyber psychology. So because when you floated out this communication training for in a healthcare segment, I felt that probably that is one area where I can expand my I can learn and expand my scope of opportunities as well, right? So when it comes to my name is Vijay. It's basically is a victory, but I would call it as Vijay. That means I want everybody to be successful, by learning from each other. So that's my motto.
Thank you so much.
Thank you.
Thank you. Thank you. God bless you. So whom do you want to nominate after you?
I can go for Dr. Hilal. Hilal?
Okay. Yeah. Mohammed Hilal, please go ahead. Yeah.
Thank you, Mr. Vijay. It's me, Muhammad Hilaluddin. I'm not doctor, first of all. I'm not doctor. Thanks for calling. Okay, one of my colleagues, Mr. Mehdi, has introduced my organization already. I am from Chittagong, from Bangladesh. I have started my job at Epic Healthcare at 2015 as customer service officer. Later of my job, I have promoted to executive in the Department of Administration. After joining of my 9 months, I have got promoted. After that, I have promoted to assistant manager of admin after 6 years. Actually, our DGM, Dr. Saifuddin Muhammad Khaled, has introduced about this program. He encouraged us, actually, me, my colleague, one of my colleagues, Mr. Dr. Hamidou Sanajad and Mr. Mehdi. They are available here. Dr. Saifuddin Khaled has encouraged us to do this program because the institution Epic Healthcare is situated just in front of a public medical college, like it's called Chittagong Medical College Hospital. That is why so many patients and from different cultures come to us and talk with us, take service from us. And that case, since there was so many people from different culture, sometimes we had to fall in many problems. That is why sometimes we can manage the problem in a very cool situation. Sometimes we had to or do something different that is not fit for the healthcare actually. That is why we don't have any practical knowledge or any clinical knowledge about this in the healthcare institution actually. That is why our sir has encouraged us to do this, and I'm very honored to be here because so many people are here, and it would be great time. I think it would be a great time for us that we can learn so many things from here. So many people are from different institution. And one more thing that, ma'am, my name is Salal. It's an Arabic word. You'd be happy to listen that the meaning of Hilal is also new moon, as like as your name in Hindu. So I'm very much happy after hearing the meaning of your name. So and I am proud of my institution because it's the first organization in Chittagong city who has the accreditation, ISO accreditation 15189 2012. That is has no one of the organization, and we are the fourth in position in Bangladesh. So I am very excited about this program. I think I can learn so many things, and it will help me to expand my experience, and as well as to expand my expand the experience of the other of my organization. Thank you.
Thank you so much. Thank you so much, Halal. Yeah. So whom do you want to nominate after you?
Of course, my colleague, Dr. Hamidou Sanajad.
Okay, Dr. Azad, please go ahead. Yeah.
Assalamu alaikum and good evening, everyone. I am Dr. Hamid Hossein Azad from Chittagong, Bangladesh. I'm working currently as Manager Operations in a leading healthcare organization of Bangladesh, that is Epic Healthcare. Besides, I lead a health-based voluntary organization named Young Social Activism Board, that is YSEB, with around more than 100 medical students and young doctors of Bangladesh. I'm very passionate about to learn health administration and health communication as well. And that's why I'm very honored to be here with you. Hopefully a nice session will be there. Thank you.
Thank you. Thank you, Dr. Azad. So whom do you want to nominate after you?
I want to nominate Dr. Parveen Manga.
Okay, Dr. Parveen Manga, please go ahead.
A very good evening to all the esteemed participants. And so nice to see people from all the spheres of life, from different professions, from healthcare as well as allied, from law and from technology. It would be interesting to interact with them all. I am Dr. Praveen Monga, an eye surgeon by profession, and currently I'm a chief ophthalmologist in Jindal Institute of Medical Sciences, Hisar, Haryana. I'm based in Haryana right now. And at the same time, I am heading the quality department of the institution. My institution is a 600 bedded multi-specialty hospital. And I'm an assessor for NABH for a few years now. I'm here to improve my communication on personal level with my patients as well as with my staff, and to propagate the same communication skills to others, especially staff, and to handle tricky situations, to handle difficult situations. It will be very interesting to interact with all the stalwarts from the country as well as the neighboring friendly countries. So nice to see you all. Thank you very much.
Thank you, Dr. Punga. Thank you. Thank you. So whom do you nominate after you to introduce?
To all are left. Dr. Rakshita.
Yeah.
Dr. Rakshita. Very few people are left.
Yeah, Dr. Rakshita, please go ahead. Yeah.
Okay. From where do I make a beginning? That's what I'm thinking. First of all, I'm not from the medical field, and I have never ever worked in any hospital. Okay, it is just that I'm interested in this area, and that is the reason why I'm here to attend the program, because I have been attending programs with Dr. Indu, and I'm from the field of HR. And of course, for the ones who are from the healthcare sector, I don't take a pride in saying that I'm from HR, because the way HR is positioned in the healthcare is not of the level that I represent HR. So by education, I am a PhD in organizational behavior from IIT Delhi. And I have worked in all the sectors, starting from information technology to chemical to oil and gas, pharmaceutical, heavy engineering, okay, and across geographies, across multinational organizations. I sit on the board of some of the companies. Now, since 2017, I'm working with 5 startups very actively. So started with an angel investment and now provide CHRO services to them. So in terms of setting up their HR systems and processes and working very closely with the founders. So change and transformation is the domain in which I work. Okay, and that is everything revolves around communication, and communication is the soul of any human existence. And that's the reason why it is so very significant, and it is something which is very close to the heart. And healthcare is one sector which is I'm extremely keen on, and that's where there's lots for me to really learn from all of you all who are here. and whatever little bit that I can contribute. And by name, of course, I am Rakshita. The meaning of it is the one who protects. So I take care of my unconscious biases. I am very mindful that whenever that I'm dealing with human beings, I apply the filter that yes, I'm very fair when I'm dealing with them, and so that I do justice to the name that I carry. Okay, so these are some of the things that I put into the practice, and I'm really looking forward to the entire unfolding of the learning which is going to be there. Thank you,
Dr. Rakshita. Thank you for introducing yourself. Whom would you nominate after you?
Let me look at the. I think
we are still left with Shipra, Dr. Shahrukh, Dr. Praveen, Mr. Vanshi Mohan.
Yeah, there are quite a few.
Yeah, quite a few.
Yes. So, Mr. Mohan. Mr. Vanshi Mohan.
Thank you. Yeah. Thank you, Dr. Rakshita. Good evening, everyone. I am Vanshi Mohan. I am from Bangalore. I have almost 21 years of experience in healthcare industry. I've been in healthcare industry in quite a few reputed hospitals like Apollo Hospital, Global Hospital. And then I was a part of that journey where they have gone through the accreditation for JCI, which is a very reputed accreditation for the hospital, and then NABH, and then NABL. So these are all the accreditations which I've been part of. But then the major thing I wanted to join this course is because I wanted to learn further how a communication can be improved. Basically, communication happens at every level, and being the head of the institute for a hospital, basically I am a cluster head for 3 hospitals and 1 diagnostic center. I work for Medicover Healthcare, which is a Swedish-based organization, and presently we have around 21 hospitals based out of Telangana, AP, Maharashtra, and we are coming up with 1 hospital in Bangalore, and that is why I am positioned here so that we can work on the project execution stage. So the main purpose why I've joined this course is because, as I said, communication is very important at every level, and between the administrators and the doctors, between the doctors and the patients, between the administrators and the patients, and at every level. If maybe I can say that it is one of the most important thing, and I personally have faced a kind of very big issue because of non communication happening between the doctor and the patient. And because I was the administrator, I was directly responsible for the entire issue. So I had to take a lot of kind of backlash from the patients, and it went to a situation where it kind of flared up in the media, and then we have to do a lot of circus kind of a thing to kind of bring it down. So this I felt was very important for me to learn and move forward. And I was also kind of in one stage where I felt that whatever I have learned over a period of time, I should be able to share my knowledge to all the people who are kind of budding healthcare professionals who are looking for such kind of communication or the understanding which any senior healthcare professional can give. So this is a very important platform where I thank Dr. Indu. In fact, I spoke to her only yesterday. I could understand what all points which she is going to cover, and I felt it was very important for me, and then that is how I joined today. So thank you, Dr. Indu, for making me a part of this group. And my name, Vanshi Mohan, my name is one of the names of Lord Krishna. And since he kinds of being everywhere, I cannot be everywhere though, but then I would like to connect to people, and I'm very happy with kind of connecting to people and exchanging the knowledge which everyone has and whatever I have. So this is about my introduction. Thank you so much for giving me the time. And I pass it on to Dr. Seema Konwar.
So before we move further with introduction, small request to all of you, keep your introduction brief, because we will get a lot of opportunity to know each other and interact. After this, I'm sure we are going to, actually the group is going to open and we are going to also connect with each other for various reasons. So because I wish to cover one topic today, I don't want to lose on time. So just a humble request to keep your introduction slightly brief, so that we can cover that topic. Otherwise, you will have to stay even beyond 10 o'clock. See, I don't know if I shared with all of you, I am in US right now and it is day here. So for me, it is all right. I can go on and on, but for you, it is going to be very difficult because it's late evening and you all must be very tired after your day long work. So if we can keep the introduction slightly shorter, then have a session, and then later on also we'll have more opportunities to discuss ourselves. Thank you. So Dr. Seema, may I request you to please introduce yourself? Yeah.
Yeah, hello. This is Dr. Seema here. I'm so sorry. I connected a bit late. Actually, I got into some emergency situation. But I'm from Guwahati. I'm working as a medical superintendent in Apollo Excel Care Hospitals out here. It is a newly acquired hospital by the Apollo Group. Here, as an administrator, like, you have to really connect to all cadre of people, like from the patients to attendants to all categories of staff. And you really need to tackle all sorts of situations, and where I feel that communication is the key thing. So that is what really helps, actually, whichever way you say, whether you are being soft or you are being a bit, a bit assertive and all, like whichever way, like it is required. And many a times, even though we have been communicating since long, but many a times I feel like we are at a loss of word when you tackle patient attendance in situations where they have lost their family members and all. I feel this course is going to really help in looking into how to tackle such situations. That's what I would like to go for. And in the beginning, I hope I had not missed on with important topics that you talked about. I just joined in now, actually.
Don't worry, you will be getting the YouTube recording of the session, so you can have a look at it. But we are just trying to know each other. That's what we are doing right now. And I haven't shared the details of the program. I'll be sharing it after we finish the introduction part. Yeah. So,
okay.
So
we love to connect to all.
Thank you so much, Dr. Seema. So whom do you want to pass the baton? Who should?
Well, I'll have to check. I didn't know who
I
have already done.
Okay.
You can only suggest. Yeah.
Dr. Shahrukh, if you may introduce yourself. Go ahead, please.
Hello, everyone. I am Dr. Shahrukh. I'm working as a senior resident in orthopedics, Maulana Azad Medical College and Loknaik Hospital. I have done healthcare communications skills course with MAM in 2016 and 2018 in MAMC. And I'm interested in clinical psychology also. I'm reading a lot of books on it since last 5 to 7 years. And I'm a part-time musician, and I run a small YouTube channel named Mindful Medic. It is related to motivation and psychology, as much as I know. And Shahrukh means, Shah means royal and Rukh means path. So it is, it means the one who takes the royal path. I always like to take the right path. Well, I would like to describe it like that way. So that's all. Thank you.
Thank you. Thank you, Dr. Shahrukh, for joining the program and introducing yourself. It's a pleasure having you here. You have been a wonderful audience, even when I did the program in the college. I'm sure this will be a good interaction. Thank you. So I think Shipra, I think you are left. to introduce, and Dr. Praveen and Dr. Chatwal, I think. If anybody else is left, please let me know. Yeah, Dr. Shipra, if you may go ahead. Yeah.
Yeah, good evening, everyone. Good evening, Indu ma'am. Yeah, I am Shipra, and I have formed a society for hospital administration, hospital administrators, and basically I'm from academics and teaching since 15 years. And since 8 years, I was working as an HOD of hospital administration department in a private institute in Dehradun. I'm from Dehradun, Uttarakhand. And now I have formed my own institute and I'm working for the students. And of course, in teaching domain, this healthcare communication is very, very important, and it is very important part of all the academics in first year. We introduce this subject in first year for all the students. So I go ahead with this course to learn and to make my students learn further. And my name, Shipra, it is and it is a symbol of purity. Thank you.
Thank you so much. Thank you. So I think Dr. Praveen.
Yeah, hi, I'm Praveen. I'm a surgeon, and I mean, I've been part of administration and with training for NABH. I've done few courses with Indu ma'am also. It was a pleasure. So I would like to refresh my training, and like all my predecessors have said, healthcare communication is the most important thing in communication today. Like, if you don't want to get beating, tell the patient what is the problem beforehand. So that is what we have learned the lesson recently. Yeah. So keeping it brief, we'll go to the next.
Wonderful. Thank you so much. So Dr. Praveen, when you asked to join the program, I was actually surprised because he's already a trainer in healthcare. He's trained by Kaho. So I was surprised that how come you are interested, but he said, no, I want to refresh my trainings and I want to learn from you. I said, most welcome. So it's a pleasure having you here. So I really need to, give my best so that you go satisfied that, okay, as a trainer, even I have learned something interesting. Thank you so much. Thank you. Then I think Dr. Chatwal, if you may please have your camera on and introduce yourself if that's comfortable. So Halal, I can see somebody with the name Shridita Saikia as a person in the waiting room. Is that somebody's name from your organization or who?
Sorry, it's me. It's Dr. Seema. I'm trying to connect by the laptop now, actually.
Okay, I'm so sorry. Okay, I've taken you in. Yeah, because sometimes I'm not aware of the name, so I get confused.
No, it's fine. It's fine.
That's okay. So, Dr. Chatwal, I can't hear you. If you're there, you may please introduce yourself. Okay, anybody else is left to introduce? Never mind. So before we move further, I'm going to share a questionnaire with you. It's more like pre-program assessment, where we stand and what we desire to achieve. So I'm sharing the link with you. It's a very short questionnaire. It should not take more than 5 minutes to fill in the answers. Please go ahead and open the document and let me know if there's any challenge in opening the document.
Ma'am, where have you shared it?
I shared in the chat box. No, you don't have to leave the Zoom meeting for this. You have to directly answer this. That's all. Keep the Zoom meeting on. It's just a minute's work. That's all. A very short questionnaire. So after you have finished the questionnaire, please write done in the chat box so that I know how many people have finished it. So during this session, you can please have water, tea, coffee, like look after yourself, keep your nourishment up, because I know it's late evening and you all must be tired and exhausted. So you really need to keep your energy up by taking tea or coffee.
Hello, ma'am. I was disconnected for a few minutes. Can you
Okay.
repeat this? I think I missed something.
Yeah, I had shared the questionnaire. It was more like pre-assessment questionnaire. Give me a second to repost it. Give me a second. Yeah. Yeah, I've reposted it.
Dr. Indu, what exactly do you mean by pedagogies? Can you give an example?
Yeah, pedagogies, that means different tools and techniques you're using to conduct your training programs. Like most of us use
one example.
Yeah, PPT. We use PPT.
Okay.
Then people use a lot of other techniques, and we are
okay.
So those pedagogies. Yeah.
So you're talking more about techniques here.
Yeah, facilitation techniques. Yeah, tools and techniques. Yeah.
Okay.
Who all are still left? If you could raise your hand, I would know how many people are still working on the questionnaire. Okay. So before we move further and discuss the first topic of the discussion today, I think I would give you an overview of the program, what this program is all about, and what is going to be the modality of the program. So first of all, I want to reiterate that the purpose of the program is to empower the participant with the deeper understanding of the essential communication skills required in healthcare in patient handling, and at the same time develop competencies to impart these skills and this knowledge to other healthcare professionals. So we have called it Master Trainer Program. The purpose is that we should not only be able to learn and imbibe and practice, but also be able to impart. So a lot of emphasis is going to be on how do you go about imparting these skills. So usually the programs that we attend, we'll get to know the content. But in this program, we have designed it in a manner where you not only will get to know the content, like for example, I've already shared a set of content with you, and then you have that book available to you. So you have a lot of material to bank upon. But at the same time, we are going to discuss in detail about the facilitation techniques, because the major hurdle we all experience is when it comes to conducting training program, when it comes to imparting this knowledge, how do we create interest? How do you engage our audience? How do you make the topic interesting? How do we make them understand that this is for their benefit? So all that we are also going to focus in this program. So the focus area of the program is not just the content, but also the facilitation skills. So a lot we are going to talk about new pedagogies of imparting these skills and knowledge. Besides that, all of you are also going to practice your facilitation skills in this. So what we have planned in the 10 sessions, the first 2 sessions are going to be the basic 2 topics. That is, what is the relevance of communication in healthcare? We're going to talk about it shortly. Second session will be about the nitty-gritties of communication, that is developing communication competencies, that is verbal and non-verbal communication. So whether you are handling your patients or you're handling your team member or you're in general handling public, how these skills can be used to make your communication effective and what factors can interfere with your communication. All that is going to be covered in session 2. So for some of you, this session may be like, we have already done it, we know it, we have an idea. But to bring everybody on page, we are going to cover these 2 topics in the beginning. Session 3 and 4 is going to be focused on how do you design a program. So session 3 will be designing the program. That means if I want to design a program for doctors, for nurses, for paramedical staff, what all do I keep in mind? That we are going to talk about. Session 4 will be on the facilitation skills. So when I say facilitation skills, how do you really facilitate a successful, impactful program? The recipe for that we are going to discuss. How do you really deliver? How do you make a beginning? How do you really engage them? What all you can use to make your program interesting? All that we are going to talk about. And then during the program, a lot of time you come across audience who are not interested, who are actually critical about your topic or your discussion or the issue that you are addressing. Or they may actually, maybe just not interested to attend, or maybe distracted, or may even ask you pointed question to disturb you or to upset you. How do you handle that kind of audience in the program, and how do you engage them and bring them to the mainstream? All that we are going to discuss in the program. Then session 5th onwards, so session 2 will be the preliminary session. 3rd and 4th will be about how do you design a program and the facilitation skill. Session 5th onwards, we will be covering different parts, different aspects of communication, which includes how do you understand patients' expectations, how do you handle patients' complaints, how do you handle uncooperative and aggressive patients, how do you handle patients one second, let me tell you, or breaking bad news, or how do you disclose medical error. That's all clinical communication, and that's what we are going to talk about in these sessions. But session 5 onwards, in every session, 3 of you will be making a 10 minutes presentation on different pedagogies. So I will be sharing a list of pedagogies. It could be storytelling, video, PPT, Socratic questioning, reflective questioning, and a huge list of it. I will be working with you hand in hand and help you learn what exactly I mean when it comes to your presentation. So in your presentation, you will be talking about one pedagogy. So if we have around 18-20 people here, we will get to know 20 pedagogies from each other. So for example, if somebody talks about storytelling, then you will actually give a small demo of storytelling, and then you will tell how storytelling can be used as a facilitation tool to make your program interesting, or how do you to convey a message. So we'll be talking about different pedagogies. So every session, I will be talking about one topic, but towards the end, we will keep 30 minutes extra for 3 pedagogies to be covered by 3 of you. So I'll share the list, and I'll also share the names who will be presenting from session 5 onwards. So that way, by the end of 10 sessions, we will have at least 18 new pedagogies that we will be discussing. So each one of you will go back with deeper understanding of how do I really, deliver an impactful program. It's not just learning, but also imparting the same skill. So this is how the whole program is planned for all of you. I'm going to share the list of topics with you. I want you to think about it, and in case if you think any of the topic is not relevant, or you want some other topic to be covered, we can consider it if the group agrees. And if all of you collectively think that this list is okay, then we are good to go, and we can actually, go ahead with the little bit about the certification. Once you have completed the program, I'm sure you all will be looking forward for the certification. Couple of things that are mandatory. One is attending all the programs. Second will be the presentations that you will be making. Then in the end, I will be requesting you to make a outline of a program that you intend to deliver after the presentation, after the program. So that will be a good beginning for all of you. You could plan a small session for maybe 10 people or 15 people. And with me, you just have to share the outline. That, okay, I'm planning a program for my nurses, or I'm planning a program for my quality people, or for my front desk staff. And this is the topic I'm thinking, this is how I'm going to do it. This is what is the plan of action. Any questions about this, or any doubts, or any thoughts about it?
So ma'am, I have one question. So when you say that, we need to design a training program, it is target audience is anybody in the healthcare sector. Is my understanding correct?
Oh yes. Oh yes. Oh yes.
Or can it be outside healthcare sector also?
I would prefer it to be for the healthcare sector, because we are learning and we are going to implement it. That's the idea. That's why we are calling it hands-on training. There is no it's not a webinar that I'm going to do the talking. It's all, lot of questionnaire, lot of discussion, PPTs, videos, role plays. I think role plays is on something that we are going to really utilize in every session, and that's going to be great. And a lot of videos we are going to see to understand how, things happen and what is the right way of doing it. So, but the program has to be preferably for the healthcare professionals, because that's the agenda of the program.
Sure, thank you.
Mr. Mendi, your hand is raised. Do you want to say something?
Yeah, ma'am. My hand was raised a little bit ago when I submitted it, but it's okay now. It's okay now.
Okay, that's fine. So, anything you wish to say about the modality, or any questions you wish to ask?
Yeah, actually, I just want to know that what you just tell in a brief, that there will be a details hands-on program. So can you share something like a demo, like how we will manage something in details?
In terms of the presentation that you will be making?
In terms of the presentation,
I will be connecting with each of you one-on-one. I'll explain you what you need to do, and then you will make the outline, and you'll discuss with me, and then you will make the presentation, because we want to make sure that you go back all prepared. So it's going to be a practice session for all of you. because ultimately you want to become trainer and you want to make sure that you want to impart this, whatever you learn. So this is going to be a kind of a rehearsal for all of you at the same time.
Okay, I understand. Thank you, ma'am.
Thank you. Any other question? Yeah, please.
I think this is fantastic because you're not only imparting us the knowledge regarding communication skill, you are also making us a part of the the trainers program. And since if we are going to have the hands-on, we're going to have a hands-on workshop, so that we'll be formulating a communication skill program for our own selves. So this is really nice.
Absolutely. I think that's the idea and why we have named it Master Trainer, because ultimately it's not just about the content. I want you to go back, with the idea that I can now impart this knowledge to my team and my, other group members. So I think we have Dr. Chetwal with us, who was probably occupied at that moment. Dr. Chetwal, if you may quickly introduce yourself, because we have not had your introduction, it will be nice to hear you.
Good evening, everybody. Am I audible, ma'am?
Yes, you're audible. Yeah.
Good evening, everybody. I'm Dr. Chetwal. I'm basically the Group CEO of 2 hospitals in Delhi. So the big hospital, what we have, one is a 150-bedded hospital. This is located in New Delhi. And the second unit is in Pitampura. This is again in Delhi. So I'm heading as a group CEO to both the hospitals. So that will be all. It's a pleasure to attend your course, ma'am. Yeah. We look forward to learn a lot of things from you. Have a good day.
Thank you, Mr. Chetwal, for introducing yourself and also enrolling for the program. Thank you. So I'm quickly sharing the list of the topics, and before we move further, I want to just have your consent. Are you okay with the list of topics, or do you want to suggest some change? Give me 1 second to show you the list. Okay, so this is the list of the topics. As I said, the initial 2 sessions will be on, first of all, understanding the relevance of communication in healthcare, and then we'll be talking about the verbal and non-verbal aspect of communication. Session 3 and 4 is about designing a training program and introduction to the facilitation skills. And rest of the topics are about communication with the patient or their family members or between us to cover the clinical communication part. So anything that you wish to suggest or comment about the list of topics? Is everybody okay with that?
Yes, I think it is very comprehensive and okay from my side.
Thank you. Thank you. So
it's
why
okay from myself.
Thank you. Why I'm asking this question to all of you is because I see a mix of group here. So in case if anybody feels that, okay, this session is not required. For example, if you think designing of a program you don't require, then we can skip that and we can have some other topic. Dr. Puneet, Dr. Praveen, anybody who wants to comment on this, and Dr. Deepak Singla, if you wish to say something.
Ma'am, I have a question. Can I ask?
Sure, sure.
Okay, since it's a dedicated program for healthcare professional and also from other profession, it's okay. But to let you know that most of them here are by doctor profession, and most of them are work on hospital. But 3 of us, we worked on a diagnostic center and also a specialized doctor's chamber. So I am just giving an example, like in cricket, there is a 3 terms of format, like T20 match, like 50-over match, like test match. So in that case, when we deal with patient in diagnostic center and doctor's chamber, the time we get for a patient to handle with, it's very minimum time. So it's very challenging for us to manage patient in a very short term, to satisfy them in a very short term. So I think please consider it, because as diagnostic and hospital service is quite different, because patients are staying very little amount time.
Mr. Mehdi, the whole program has been designed with the idea, keeping in mind the Indian or Asian healthcare delivery system, where we all are facing more or less common challenges. In government setup, the workload is too much. In private setup, the patients are very demanding. So we are going to discuss about all these, real life situations and challenges that we are facing. And I'll try my level best to share my experience of conducting 2000 programs across the country and the input I have received and the ideas that I normally share with my audience to see how you can tweak your way of handling and, interaction. The objective is the patient has to go satisfied. That's all. How do we do it? We are going to talk about that. It doesn't make a difference whether the patient is free or paying. I have less time or more time. It doesn't make a difference. And that's what I am here for. And that's what is going to be the agenda of discussion. Thank you. Yeah, Dr. Rachita, I think you wish to say something. Go ahead, please.
Yeah. I saw the agenda. It just came to my mind that do you want to just focus only from the patient and doctor relationship or the one's medic angle? Or you also want to incorporate the angle of interacting with the management?
Actually, we will be going out of the scope of the program. The idea is, see, if you look at the title that we have given, it's basically with the patient specifically, but at the same time, whatever communication skills we will all learn, that will automatically be usable and applicable in any front of life, even in our personal life. For example, if I'm going to impart skill on assertion as a communication skill. So assertion you can use even in your personal life with your children, with your spouse, with your neighbors, even at workplace with anybody and everybody. So principles of communication remain same. Application is vast, but we will be taking examples from the doctor-patient communication or healthcare or provider-patient communication. Why talk of only doctor? Provider-patient communication. So from that, or most of the situations also will be taking, from that setup, but the learning can be applied to any, area of life.
Okay, because the idea was that, okay, with the kind of, corporatization of healthcare, how do you bridge in that kind of a communication gap which occurs? Because probably, the medics are not that much familiar with the corporate lingo and the way in which the things need to be done. So probably that was the idea behind asking this
the
question.
only thing is, if we will be going on that side, then we'll be digressing from the main agenda.
Fine. I'm absolutely fine. I mean, I just wanted to understand that.
Definitely in between, we can have discussion about it. And whenever somebody will bring in some case or some situation, I'm sure all these things will be somewhere addressed directly.
Yeah, because it is actually coming from some of the hearsay cases, which I keep hearing, where the medics find it challenging to really convince the management when there are some patient-related issues.
Absolutely. So I think once we'll discuss the, communication styles and other aspects, automatically they'll be able to use it in their, professional setup, even with their management also.
Sure.
So again, starting with the now we are going to formally start with the discussion about what is the relevance of communication. So first question that I want to ask all of you is, and I would again request, please be brief, give others also a chance, and we have just 35 minutes at hand right now. I know a lot of time has gone in for the introduction and other things, but we will keep it crisp and to the point. Just quickly, if you would like to write in the chat box, why suddenly communication has become so important? What has changed? Please write in the chat box, write your answers in the chat box. Why communication has suddenly become important? Absolutely. I think some beautiful answers that I'm receiving from all of you. Mr. Mohan says patient expectations have gone up. Absolutely. When they're paying, they want value for their money. This change in expectation due to exposure. Yes, because they have access to information. They Google uncle is right at the click of the button, so they can get all the information, within minutes. Yes, awareness has gone up again because of the access to information, changing dynamics of doctor-patient relationship. Very right, Dr. Singla, but can you specify what has changed? What has changed? I mean, if you want to even unmute and speak, it's okay, but I want to understand what exactly you mean.
Basically, the society as such is changing. The role models are changing. The media has also played its own role. Patients' expectations are increasing. Doctors are also becoming less communicative. And
Absolutely.
the role model which we had when we were graduates and all, those role models are also nowhere seen. So it is both ways.
I completely agree. I think that's what even others are saying. Mr. Vijay says media influence is very high. Mr. Mohan says it ultimately defines relationship between people. Absolutely. And it has changed. So now we have more demanding patients, more informed patient, and commercialization of medical care. Yes, Dr. Rich, I completely agree with you. Dr. Puneet says changing scenario of medical practice has made the health sector consumer very demanding. Yes, I think a lot of factors have actually put into. Yes, fast life, agreed. Social demand, awareness, and healthcare competition. Effective communication is important for fulfilling the demand of both parties. Yes, I agree with you, Halal. Then Dr. Sheetal says we tend to talk to the patient with the theoretical knowledge. We need to think like the patient thinks. Yes, that means we need to really understand patient's perspective. And that's where we lose the reality. We're not in touch with the reality. Patients' knowledge about healthcare through Google has changed. Absolutely, yes, I said they have access to information. Current level of dissatisfaction of patients raised expectation, decreased trust. Yes, I think trust is a very big factor and we really need to work on it. How do we really get back that trust? Shahrukh says, because people now know their rights and they want answers for everything which is being done. They want to participate. They want to actually know everything. I completely agree with you. Yeah, networked organizations functioning. Yes, Dr. Rakshita, I agree with you. Shipra says healthcare providers are so stressed with their day-to-day activities that they sometimes become rude to the patients and time given to each patient is less. So we want effective communication. I agree. Yes, we are all experiencing stress, but I cannot use it as a reason because that's going to, I'm in the court of law. I can't say I'm tired and I'm exhausted, so I misbehaved with my patient. I can be sued for this. I think Mr. Mohan will tell us more about it because that cannot work as an excuse. So I can see a lot of answers. Absolutely. I think I completely, agree with what you are saying. That means things have changed. I don't think we ever thought of something like this that we are having, where people like you are sitting and trying to understand what clinical communication is. Why do I need to learn? Although each one of you may be an excellent communicator in your own capacity, but when it comes to handling patients, we are still challenging. That means there is something different when it comes to communication with the patient. So my next question to all of you is communication with patients same to our day-to-day communication or it is different? Say yes and no in your answer in the chat box. Is our
Sorry, ma'am. Can you repeat, please? Sorry.
Is our communication with the patient same as our regular communication or it is different? Say yes or no. Okay, most of you are saying no. Some of you are saying yes. So I would like to maybe ask one of you who is saying yes. Dr. Monga, you said yes. I want to understand. I'm not disagreeing with you. When I'm asking you to speak, I'm not disagreeing with you. Dr. Monga, if you may tell, how do you think? How do you think?
When I see patients day in and day out, they want the same communication as we do with our nears and dears.
Absolutely.
Their expectations might have different, but in my communications, they want to feel the connectivity which I have with my nears and dears.
Absolutely.
So, methods of communication might be different, but the intent of communication has to be the same.
Absolutely. I agree with you. That means patients today want respect. They want to be heard. They want to be treated fairly. So that means it's the communication that we do day in, day out with our friends, family, and everybody. Dr. Chatwal, you said no. I'm sure there is a reason why you said no in the answer. Can you explain why did you say no? I'm not disagreeing with you. I'm just trying to understand on what are the reasons you said no.
And it depends upon the patient, and yes, at times, yes and no also. Because, you have to be different with different patient because you don't know how is he going to predict things with you. Patient who is counseled well, when he becomes agitated, you doesn't know.
Absolutely.
Patient who's not counseled well, what phase he takes, you doesn't understand. As very rightly said, I would be 50% no and yes, because you have to look for the patient perception. What is he demanding from you? So in the nowadays practice, I think at times we really need to change according to the patient expectations. Yes, treatment modality, we remain strict to the treatment modality, but we have to understand his psychology, what is he expecting?
Absolutely.
So at times, we have surgical patients, he's not convinced to go for the surgery. He says, "Nahi, conservative, I want to get managed." But how do you explain him that a lap chole has to be done, How can you do a conservative management of a gallstone? So, at times, yes, I think it's something, yes and no. I agree with Dr. Monga also. So that is the reason.
Thank you. Thank you. So when I say no, it is not same. My reason for saying no will be, it is not a communication between two healthy people.
Yeah.
There's a huge knowledge differential. You being a clinician, you know this subject. Patient being the patient is a patient and is in need of service. Plus the patient hasn't come voluntarily, happily. Patient is suffering. Patient is in pain. So that means the patient is affected by the disease. So naturally, it is not a communication between two healthy people. So by virtue of their position as a patient, they actually expect us to be proactive in our communication. And that is why the communication is not similar to our day-to-day communication. I'm sure each one of you may have had a reason for, saying no, but I wish we had time, we could talk about it. Very quickly, I want to, give you a very quick, questionnaire to help you see, is my communication with my patient appropriate? When I'm saying this, please say yes when you're doing it for all 100% of the patients or for most of the patient. If you're doing it for once in a while patient, then that's not true. But just see how are we communicating. So maybe some of you are not dealing with the patients. It could be your staff member. So here comes the discussion that Dr. Rakshita was saying. How about communication with the team and management? Do I communicate with my team in the same manner? This is something I want to, you to just introspect. Very quickly, very short questionnaire. If you could quickly attempt. So the same questionnaire I have given you in the content that I have shared with you at the end. So you can use this questionnaire when you are doing any program for your set of audience. So this will give you a great baseline to start discussion with your team, because once they give very honest answer, you will have a very mixed kind of a response, and you will get to see how we fail to even do small gestures, which does not take time, but it's a matter of intention, desire, and attitude towards patients that we have. So I'm going to share the screen with you to help you see the total, and nobody's name is going to be, seen who has answered what, but as a group where we stand, I think that's what we are going to see. So I have 16 responses. Dr. Rakshita, this questionnaire is available in the content that I have shared with you. And
no. I'm saying not applicable.
Okay, no, but you could even use it when you are dealing with your, staff. Again, the conversation is about, how do you handle your team members? Even that is, I mean, it has to be slightly tweaked, but more or less. I mean, but that's what I'm saying. Yeah. So I'm sharing this screen with you to help you see the answers that we all have given, and that will give you an idea. See, simple things like, do I greet the patient? 16 of us have answered this. 7 of us say always. 6 of us have said most of the times. That means not always. And 3 of us have said sometimes. That means even a simple thing like greeting the patient or addressing the patient by name. Again, 7 of us have said most of the times, 4 of us have said sometimes, and 1 of us have said never. So again, that means basic things like addressing the patient by name, greeting the patient, introducing ourselves. We do not like to introduce ourselves. We assume that the patient knows us. A lot of time the patient does not know who I am. And if you introduce yourself, they would actually be very clear whom they are talking to. Then eye contact. Most of you have said yes, but some of us have said most of the times. That means I do not make enough required eye contact. Do I offer seat? Again, 12 of you have said yes. 4 of us have said most of the times. That means sometimes we don't offer seat to our employee or our patient. Do I begin the conversation in an informal way? Again, 3 of you said yes. Rest of you have said either most of the times or sometimes and never. Again, building rapport is an important aspect of patient communication. And for that, if you are able to start little bit of small talk before the big talk, that makes your patient comfortable. We'll be talking about it in this session, but that helps in making your patient comfortable. Then allowing the patient to narrate their problem. 9 of you have said yes, whereas 6 of you have said most of the times, and 1 of you have said sometime. So you can see from your answers, do I listen to the patient problem? When I say most of the time, 6 of us have said, that means we are not, always ready to listen to the patient problem attentively. Do I attend or listen to the patient's problem patiently? Again, some of you have said sometimes, and some of you have said most of the times. I think that's another common complaint we have from the patients coming. Do I use empathizing expression? May I request you to keep your device on the mute mode? Somebody's device is, audio is on. Please mute your device. So you can see from your answers, I mean, we are all in this subject for years, but probably never realize the importance of these small gestures. Do I address the patient's emotional issues? Example, anxiety, worry, or their concerns. Again, 4 of you have said yes. Rest of us have said either most of the times or sometimes. And that's one area we are actually very uncomfortable about, because we don't know whether we should be actually indulging into it. Should we really be talking about it or not? And even if that is brought up by the patient, how do I deal with it? We are going to talk about this in the coming session. In the end, do I ask the patient, do you have any more questions? So again, either we don't allow the patient to ask questions, or even if they have questions, we kind of, give minimum information, and asking, do you have any more question is much less practice. Then do I ask the patients what is the patient's ideas or concerns and expectations? Again, this is something that we really need to understand, because the patient has some concerns and that needs to be addressed. So I think again, even about the emotional issues, you get a fair idea that only 4 of you have said, yes, I always address the emotional issues. The rest of us, we say most of the times or sometimes. So when we say most of the times, maybe for the patient for whom we are doing, that patient will be satisfied. But what about the patient for whom I'm not doing it? So that patient is going to go back dissatisfied and can, can backlash or can harm us in some ways. Do I clearly communicate the next checkup? 10 of you have said yes, always. Again, some of us have said most of the times and sometimes. Do I lose patience? I mean, I would say very honestly, you have mentioned that sometimes I do. That means I do. That means I need to understand if I'm losing patience with my patient, how is that going to harm me and my patient? Do I thank the patient? Only 7 of you have said yes. The rest of us have said most of the time, sometimes or never. Again, that's a question to be asked. Do the patient look satisfied? Only 4 of you have said yes. 12 of you have said most of the times, and 2 of you have written sometimes. That means the patient is actually satisfied or not satisfied. I need to really check. Am I satisfied? Again, only 4 of you have said yes, always. Rest of you have said most of the times or sometimes. So the idea of this questionnaire is to help you see these are all small things, very, very small things. Sorry, my video was off. I'm really sorry. Okay. So the idea of this questionnaire was, see, such simple things I asked. Do you greet your patient? Do you make them say? Do you ask them how are they feeling? Do you allow them to speak? These are the small things that do not require time. But if you are doing mindfully, if you are doing attentively, these are the things help us build rapport with the patient. These are the things patient really value. Studies suggest patients do not care for our clinical skills. That does not mean that we don't have to be clinically sound. But studies suggest they value our communication skills.
Sister, bye.
Dr. Rajesh, can you mute your device? Dr. Rajesh, can you please mute your device?
Yeah.
So what I'm trying to say, when you will give this questionnaire to people with whom you're going to do the training program, they will get to realize these are the small things. They don't require time, but they just require attention. So this lays the foundation of preparing them that, yes, we need to understand what is the right way of handling our patients. And common complaint, I think you all must be having even from your staff, is that they would do everything, but they would do it mechanically. A lot of time I get to hear, they don't fail to do their duty, but they refuse to smile. They refuse to connect. They refuse to go an extra mile to send the patient satisfied. Do you agree with me? And this is what the patient is looking for. This is what the patient is looking for. So again, I'm moving on to the presentation because we are just left with 20 minutes and I'm not going to now, delay the presentation. And that's going to, in a way, talk about what is the importance and relevance of communication in healthcare and what do the studies say and what is expected from us. So I hope the presentation is visible to all. Okay. So practice of medicine was much, much easier and simpler earlier. Patient actually never asked us anything and we never had to say anything. Today, and a lot of you have written in your answers in the chat box that things have greatly changed. And I think most of the things you have already mentioned in your answer. Patients are more aware, they're more demanding, media participation has gone up, litigation is high, extent of fights have gone up. We are experiencing a lot of violence and litigation against doctors and healthcare professionals and healthcare organizations. So all these changes bring us to a point where we need to sit and introspect. Is my communication appropriate with the patient? Am I communicating enough? Am I building good rapport? Am I sending my patient satisfied? This is something we never actually earlier cared for because this is something patient never asked for. But today they are looking for something like this. So we got to really understand How do I send my patient satisfied? What do studies suggest? You'll be surprised to know that studies suggest that the provider-patient communication is often inadequate. It's a report by Institute of Medicine that says that healthcare professionals lack adequate communication skill training. For example, we don't allow the patient to speak. When the patient speaks, we interrupt the patient. We don't have... Can you please mute your device? So we don't allow them to speak, or even when they are speaking, we don't pay attention, we don't facilitate, or we don't like having long answers. So studies suggest that we do not communicate adequately. Any idea in how much time do we interrupt the patient when they start speaking? Write your answer in the chat box. Please write your answer in the chat box. In how many minutes or seconds we...
airport
Can you please mute your device? I'm really sorry. I request all of you to keep your device on mute mode. Okay, so somebody says 23 seconds, 2 minutes, 2 to 3 minutes, 10 seconds, 2 minutes, 5 minutes, 5 minutes, 2 minutes, 15 seconds. So quite close guess by some of you, actually it is 11 seconds. This is the recent study that says that we interrupt the patient within 11 seconds. Earlier studies was 13 seconds. Now it is 11 seconds. So when the patient starts talking about the problem and we interrupt the patient, and sometimes we actually not interrupt, we snub the patient. So when I take a session for government sector and I ask them, if the patient is talking something irrelevant, what do you do? A lot of time they would say, we tell them, don't talk irrelevant things, come to the point. ज़्यादा कहानीबाजी मत करिए, जो पूछ रहा हूं उसका जवाब दीजिए. And that's how we actually snub them, we stop them. We usually think if we allow the patient to talk, patient is going to take a lot of time to narrate. Any idea in how much time can they, talk about their problem? Write in the chat box once again. And how much time do we stop the patient? But if we don't allow, we don't stop them, how much time will they can they actually talk about their problem? Okay, some of you say 2 minutes, 5 minutes, 40 seconds, 3 to 5 minutes, sometimes 7 to 15 minutes, 10 minutes or more, 3 minutes. I understand from where it is coming, but the studies suggest that patients actually are able to talk about their problem in 80 seconds. So when I'm saying this, some of you may not agree with me. I completely agree. In your practice, some patients need to be actually asked to speak. They would not open up easily. So you'll have to really ask them, tell me what is your problem. And there are some set of patients who you'll have to actually literally fold your hand and say, please chup ho jaiye, so that I can also ask you some questions. But 60 to 70% of the patients talk to the point. And if you allow them to speak, they are able to tell about their problem in 80 seconds. And their satisfaction multiplies many, many fold. Studies also suggest that we do not explain to the patient appropriately. So I'm going to I'm showing you a paragraph. I request you to read this paragraph carefully. What did you understand?
This was so fast.
It was very fast. You didn't understand anything. I completely agree with you. I understand. This is what exactly happens when you explain to your patients about their diagnosis, process, and treatment. Studies suggest we use a lot of technical jargon. The way of explanation is very hurried. As a result, they don't get to understand what we are saying, but they will not usually clarify because they're too scared to ask you that I have not understood. 50% of them do not understand anything when we explain them about their disease or their treatment. Studies also suggest that we do not meet the basic standards of informed decision making, because we are in habit of taking decision on patients' behalf. This was the usual practice. Today, patients want to participate in decision making. They want to be informed, the options available, the risks involved, advantages, disadvantages, cost, aftercare. So they want to take a decision based on the information they get. But studies suggest that we do not practice this in real sense. So some clinicians who feel that shared decision making is not appropriate in every situation, they think that's not required. In contrast, we have people who actually advocate shared decision making, and they say that it is suitable in every situation. And you may have seen a lot of time, we do not give complete information to the patient, fearing that the patient might run away. And also, some of the complications or the risks are very rare. So we think that's not required. So we got to really see the situation, understand the patient's psyche, and make sure that we win their trust and give them the required information. And the consent that we take is actually an informed consent, so that they are not, tomorrow they don't take us to the court. In a recent study, 45% of the families reported lack of clarity on treatment and care options. They felt unempowered in the treatment of their patient. They perceived a lack of involvement in deciding the treatment modality. They expressed inadequate clarity of the diagnosis, and they also felt rushed consultation. Many of us consider the patient as the primary beneficiary of our care, but we do not understand or address families' concern. So according to the same survey, 32% of the patients and their families indicated that the attending doctor did not straight away address their questions and doubts, because we think it's the patient care that's important. The family's concern is not very relevant. The answers that we saw in the questionnaire that we took just now, when it came to addressing patients' anxiety, their concerns, their idea about illness, and so studies suggest that we are not addressing the family's concern. So that means we are not communicating with the family. So if I may ask you, what do you think are the benefits of learning communication for the patients? How will that benefit the patient? Please write in the chat box. Write in the chat box, what do you think are the benefits of learning communication for the patients? How will that benefit the patient? Enhance confidence in the caregiver, absolutely right. Satisfaction, compliance, safer treatment. Yes, Dr. Deepak Singla, I agree with you. Dr. Puneet Gupta says communication will help in correct treatment delivery. Absolutely, absolutely right. Dr. Sheetal, you are sending the message directly to me. It's better if you send the message to the group so that others also can read your answer. Patients will be satisfied and will be part of the treatment process. Yes, better clarity on the diagnosis, treatment option. Giving information correctly and communicating will help the patient make an informed decision. Absolutely. Better attitude towards the healthcare worker. And also patient satisfaction will rise. Absolutely. They will have a better understanding of their disease, increases satisfaction level. They will be satisfied and feel confident on the treatment. Absolutely. That will improve confidence. Completely agree. I think all of you are on the right track. Absolutely. So that way patient will be benefited by being satisfied. You also, when they understand their treatment or the prognosis, compliance will be better, expectations will be looked after, they will have trust on the doctor because the doctor has shared all the information with them. So automatically the patient is going to be happy. So how are we going to be benefited? How are healthcare providers going to be benefited? If you may write in the chat box. Are we also going to be, benefited, or it's just the patient? Yes, of course, there will be less conflict. I agree. satisfied patient will turn into repeated patient. I absolutely agree. So that's a organizational benefit. So how are we going to be benefited if we are practicing effective communication skills individually as a healthcare provider? Yes, enhances our productivity. Yes, our professional satisfaction will be high. There'll be less stress. Absolutely right. Satisfaction, better teamwork, business, less legal hassle. Absolutely. Build an excellent doctor-patient relationship, build trust, have a good rapport, less litigation. Absolutely, I agree with you. Personally and professionally, we are definitely benefited when we have effective communication with the patient. How are organizations going to be benefited if we have good communication as a culture in the organization? Yes, Dr. Praveen, you're right. Better relationship with the patient, less conflict, better practice and revenue. Absolutely. Patients who are satisfied, they're going to promote. Yes, they are going to promote your work. Better branding, absolutely. Better business, absolutely. More transparency will improve the branding, basically patient-centric approach. Yes, the loyalties of the patient will increase. Good teamwork, absolutely. Staff will be happy to be with you. They will love to be with you. That enhances revenue, absolutely. Studies have suggested that effective communication not only improves patients' compliance and patient satisfaction, it actually changes the outcome. Multiple studies have demonstrated that patients who experience effective communication with providers report better pain control and improved responses to pain management modalities. So it is not just the feel-good factor, but it actually improves the outcome also. Similarly, better control and effective management of chronic diseases like diabetes, cholesterol, high blood pressure, and HIV. Just with the effective communication with the patient. Also, there is improved outcome after cardiac surgery and decrease in post-operative complications such as cardiac arrhythmias. So I've given the studies under it to give evidence to what I'm saying. So it is not just feel-good factor, but the patient outcome automatically improves when you have good communication with your patient. Of course, patient compliance improves. Patient compliance across the world is 30%, 35%. But it's a direct outcome of your ability to build rapport with your patient and communicate effectively. Better patient compliance means better patient outcome. Even the perception about the quality of care changes. They will perceive your care better than others. Even if you're writing the same antibiotics, same medicine, same procedure, but they will find everything better than the other setup just because you and your team is communicating effectively. All this is going to lead to greater patient satisfaction. Similarly, for healthcare providers, as you said that you will have better teamwork, better coordination. Actually, it is true. Can you count the number of persons involved in a simple activity of blood investigation of a patient admitted in a hospital? Write in the chat box the number of people that you think will be involved in a simple activity like maybe a blood count or something like this. How many people do you think will be involved? Four to 5, 6 to 8, 5 at least, 7 to 10, 10 to 15. Absolutely right. 5, 6. That means that many opportunities of error. More the people involved, more the possibility of error. And if we communicate effectively, I think there can be better coordination between the team members. Automatically, that's going to, reduce the number of errors. Any idea in an average stay of 3 to 4 days, how many hands does the patient's information exchange? Again, write in the chat box. How many hands does the information exchange? 30 to 40, okay. 10 to 15, okay. 15 to 20, 20 to 30. Again, 10 to 15. 50 to 60 hands. In a 4 3 to 4 days time, patient's information exchanges around 50 to 60 hands, and that many opportunities for error. If we communicate effectively, we can ensure reduction in error, which will ensure patient safety and continuity of care. There will be reduced friction in day-to-day working. So we spend around 8 to 10 hours in our workplace. I always say we spend more productive hours in our workplace than at home. We go home to have food and sleep and do other things, but most of our interaction happens during the day at our workplace. The workplace has to be cordial. If we communicate effectively with the team members, with people who are our support system, automatically there'll be reduction in the friction in day-to-day functioning. There'll be, of course, reduced conflict with the staff, patient, and their family member, because day in, day out, we are interacting with them. According to JCI, medical errors are the third commonest cause of death. This is in US, not in India. We haven't done any study in India. I don't know if we did that study, where we will stand. And 60 to 70% of these errors are because of poor communication. A study by Professor Ashish Shah from Harvard University estimated that 5.2 million medical errors happen annually in India. I think there are more than this. This is an underestimated number. Medical errors like wrong site surgery, wrong medication, wrong organ removal, wrong treatment, wrong patient, they are very common. Most of these errors are around medication error and patient care and surgical errors, and some are about infection. Most of these errors are due to internal communication failure and lack of coordination. Let's do a small activity. I know.
And obviously, most of the mentioned errors are related to communication errors.
Absolutely. So communication of even clinical information is communication. Written communication is also a communication. Documenting treatment is a communication. So all is nothing but communication. So I'm going to put 5 of you in the waiting area. And then we'll be doing a small activity. So I'm not picking anybody. I'm just looking at whose name comes first. I'm going to send you in the waiting area and call you one by one. Dr. Deepak Singla, is it okay if I put you in the waiting area?
Yes, absolutely
Okay.
fine.
Thank you. So I'm putting you in the waiting area. Dr. Puneet Gupta. Again, I'm putting you in the waiting area. Dr. Rajesh Talwar. Okay. Dr. Azad. 3, 4 people have gone. Okay. Dr. Praveen Monga. Okay. 5 people. Okay. So I've sent 5 people in the waiting area, and I'm going to show a slide to all of you, but one of you specifically. So maybe Dr. Seema, if you can have your camera on. Dr. Seema, are you there?
Yes.
Okay, so I'm going to show you a slide which you need to read. Even others will be able to read. Once you read this slide, just let me know that you have read and you are ready. Give me a second to show you this slide. Yeah. Okay, all others can also read, but read it to yourself. Tell me when you're ready. Ready? Okay. So task for all others is you will be observing what happens in the session. Keep writing in the chat box, but don't push the button. Don't click the button. Just keep writing your observation, whatever you observe in the activity. Once I asked you to share your observation, then you have to, click the button of chat. Otherwise, keep writing what you're observing. So Dr. Seema, I'm going to enter one of the participants from the waiting area. Whatever you have understood, you need to share that with the participant that I bring in. So I'm bringing Dr. Rajesh Talwar. Once he comes in, let me explain to him, and then you explain whatever you have understood from him. So Dr. Rajesh Talwar, if you may please have your camera on. Dr. Rajesh Talwar, are you there? Okay. No, he's still joining. I think there's some network issue. Okay, I'm admitting Dr. Praveen Munga. Dr. Seema, I'm admitting Dr.
Yes.
Praveen Munga because Dr. Talwar, I think he has some challenge in it. Okay, so Dr. Munga.
Okay.
Dr. Seema is going to share a set of information with you. Please listen to her carefully. Dr. Seema, please go ahead.
I'll be sharing the ones that you have shown.
Yeah. Whatever you have understood in your own words. Yeah.
Okay. So there's a patient, 65-year-old. He's suffering from pulmonary tuberculosis. And then he's in the ICU since 5 days. And the family wants to meet the doctor. They want to know about his condition. And since they want to know about the financial implication also, since the bill has already been a bit high, so they definitely would like to know how far, they will be able to pay, or how far the treatment is going to go, whether, what sort of the outcome of the treatment also.
Thank you.
Like, yes.
Anything else, Dr. Seema? Yeah.
Should I start my opinion?
Yes.
No, Dr. Bunga, hold on. Dr. Bunga, hold on. So Dr. Seema, you have finished?
Yes, ma'am.
Okay. So Dr. Munga, I'm going to enter the next person, Dr. Puneet. So please share whatever you have understood from Dr. Seema, please share that information with Dr. Puneet. I'm admitting him. Let him join and explain to him. Okay. So Dr. Puneet.
Same thing.
Yeah, Dr. Puneet, Dr. Praveen has a set of information he's going to share with you. Please listen to him carefully. Dr. Praveen, please go ahead.
I have been given a condition with a patient, 65-year-old patient has been admitted in ICU with pulmonary tuberculosis. Patient is admitted in the ICU for last 5 days, and his relatives wants to know the condition. They want to meet the patient. They want to know the condition and prognosis, implication, financial implications of the patient.
Okay. Dr. Praveen, have you completed? That's okay. Okay, thank you. So I'm going to admit Dr. Deepak Singla. So Dr. Puneet, you have to, whatever you have understood from Dr. Praveen, you have to share that information with Dr. Deepak Singla. So let me, Dr. Deepak Singla, Dr. Puneet is going to share a set of information with you. Please listen to him carefully. Dr. Puneet, please go ahead. Please unmute your device, sir.
It is unmuted.
This is about a patient who is admitted in ICU for about 4 to 5 days. suffering from pulmonary tuberculosis. The attendants of the patients wants to know the actual condition of the patient and what is the prognosis, and also the cost, etc. of the treatment.
Is that okay, Dr. Puneet? You're finished?
Yeah.
Okay. So, Dr. Singla, I'm going to enter Dr. Azad. So whatever information you have understood from Dr. Puneet, you have to share that information with Dr. Azad. So let him join, and then I'll explain to him, and then you have to share that information. Yes, Dr. Singla, Dr. Azad is there. Dr. Azad, Dr. Singla is going to share a set of information with you. Please listen to him carefully.
There is a patient admitted in ICU with pulmonary tuberculosis for the last 3 to 4 days, and the family wants to know the condition of the patient as well as the expenses involved.
Thank you. So, Dr. Azad, whatever you have understood, can you share with everyone?
A patient admitted in ICU for 3 to 4 days with diagnosis of pulmonary tuberculosis. And last part of the conversation I missed. I couldn't understand properly. So how do you approach to his family? I think something like that.
Do you want me to repeat?
No,
yes.
No, sir, no. That's not the task. The idea was to see how the information gets, distorted. What did all of you see? Those who were present throughout the program session, what all did you see? What got changed or tweaked when it came to sharing the information? What all got lost? So
the
information.
fact that he was 65 years old.
Okay, age was gone. Name.
Age
what
was
about
gone.
name? What about
5 lakh
name?
rupees has already been spent.
5 lakh rupees we have not talked about, and we said that wants to talk about the cost. Okay.
And the fact that his son was the sole breadwinner.
Yes, his son is the sole breadwinner, and he's concerned about the patient's recovery or
concerned about the patient's recovery.
So this is exactly happens, when we communicate, especially handing over. When we hand over patient from one care area to another, it is considered Bermuda Triangle of healthcare. 60 to 70% of the information gets lost in this process. So how could have this, losing of information could be prevented? How could have we prevented this?
Adequate notes in the case sheet.
Absolutely.
Written communication.
That means
by the structured written communication.
Absolutely. So if there was a structure, if there was a way to hand over, probably the information would have been handed over in the right manner. But a lot of time we write information because a lot of hospitals are practicing written handover, and they have wonderfully developed, structures. Even then lapses happen. Why?
Because of the lack of time.
Because we don't read.
Overconfidence.
Could be over. For example, I receive a patient with a huge, set of documents. What will I actually look at?
Most of the time, they don't even check the checklist or the handover.
The last document, the last message, the last instruction. What about the previous days that the patient has, been treated for? So a lot of time when we hand over one patient from one care area to another, for example, the patient is coming from ICU to ward, or from emergency to ICU, or from OT to ICU, lot of information gets lost. We may write, but nobody reads, and nobody goes and communicates. And when somebody says that I was not told, somebody will tell you it's already written in the patient's case sheet. So the whole information gets lost in that process. We are going to talk about handing over tools in one of these sessions in depth, why proper handing over is important, but yes, if the person who was taking over had noted it down. Okay, patient Ram, age 65, diagnosis this. And it's not anybody's fault. This is how we kind of miss information. Selective listening. So the information that got transferred till the end is something that was selective listening. The person who thought it was important communicated to the second, to the third, to the fourth. Here, information was still more or less intact. A lot of time, the information becomes so, mingled up that the whole meaning gets lost. Handing over is never given. Handover is always taken. So the person who was receiving the information, if that person who had asked, I did not understand, can you repeat it for me? Can you give me time to note down? Because then when somebody is talking to me about something, and if I don't understand, it's always good to ask, sorry, I did not understand. Can you explain this to me once again? How many times do we do? Then another important tool to confirm whether the person has understood is called teach back. The person who was handing over, was giving the information, if that person had asked, have you understood? Naturally, the other person would have said yes. Then the person should have asked, tell me in your words, what have you understood? That's called teach back. So these are all basic things. If we practice in our communication, we can prevent loss of information. When you're communicating to your nurses, to your technicians, a lot of time they will not understand what you're saying. But because of their respect for you or fear from you, they may not ask you, sir, I didn't understand. Or the fear that you may say, Buddhu hai kya tu? Are you stupid? Tumhe itna bhi samajh nahi aata. Who would like to be, addressed like this? So everybody will say, Hanji, sir, Hanji. Ask them, have you understood? Trust me, 60-70% of that will not be accurate, especially if it is complex. And anywhere if you have used any technical jargon. When you write discharge summary for your patients, ask your patients, have you understood? They'll say yes. Tell me in your words, what have you understood? You will get to realize a lot of information will be messed up. So this is what exactly happens. And we think the communication failure happens from the patient side. It is from our side because we are not able to communicate in the manner the patient understands. So if we could communicate effectively with patients, with our team members, these medical errors could automatically be reduced. Even the risk of medical negligence allegation goes down if you communicate effectively with your patients and their family members. You'll be surprised to know, studies show that in 2/3 of the legal claim for medical negligence, poor communication was the issue in the background. When you will go deep into the root cause, you will see somewhere they felt cheated, somewhere the family felt that the doctor or the team was not transparent. They were not forthcoming with the information. That means something has gone wrong, even if nothing has gone wrong. They will have this perception or this fear, and then they would litigate. Another study shows that the most important factor in people deciding to file the lawsuit is not negligence. It is ineffective communication. If you are able to communicate, talk to them, explain them. And I will be sharing a couple of studies with you where the hospitals as a policy has gone into, fair disclosure of medical errors or other aspects of communication, and their litigation cost has gone down, their claim cost has gone down, the patient satisfaction has gone up. I'll be sharing those studies with you in the, some of the sessions in the company. So sensitive communications like breaking bad news, end of life care, grief counseling, like Dr. Puneet was mentioning, that in retrovisional surgery, we know sometimes the prognosis is poor, but it is still worth taking a chance because we hope that the patient will be able to gain back the vision or we can prevent deterioration. So these are very intense communication. For example, a patient has to be enucleated. as the patient has developed endophthalmitis and the patient needs to be enucleated. It's such an intense, difficult communication. How do you go about, doing this communication, counseling the patient, helping them understand that this is the only way we can save the patient? For example, the patient has to undergo foot amputation. It's not a small thing. It's a very big thing. So preparing the patient for foot amputation, it requires a lot of understanding of how the patient must be feeling or thinking, or what must be patient's concerns. And then in your conversation, in your dialogue, you are asking for those concerns and answering those questions. So all that requires training, all that requires learning. Incidentally, studies suggest that either we are too blunt or insensitive in our communication. Sometimes we are just speaking as a matter of fact. So in one of the studies, patients and their family members felt the doctor was too blunt, or the place or the time was not appropriate. Or Dr. Hamid, there's another, and somebody entering with your name. Dr. Hamid Azad. Who is that person?
Yes. I'm trying from mobile phone because my laptop is disturbing from video options. That's why.
Okay. And then they wanted physician to balance between the sensitivity. And what is that balance where you have to tell the truth and you have to be honest? At the same time, you need to be sensitive and not blunt and rude. And that's intense communication, and we need to learn, and that's part of communication. Effective communication also reduces the risk of violence. A lot of violent situations can be handled effectively if you are able to manage proactively the patient and the family. And then in case if there's a mob attack, how do you really go about communicating with them? We are going to talk about that through role plays, through different activities. All this is going to definitely improve your professional satisfaction. Once you're able to do all this happily, you can send your staff, your team, your patients happy. You're going to feel happy and satisfied with your communication. As institutions also, we benefit if we have an environment where people communicate with each other in respectful manner, in a cordial manner. So good work environment is created if we communicate effectively with our team and subordinates. There is definitely greater job satisfaction among staff. A lot of time you will see people moving out of the hospital or leaving the hospital or leaving their place of work and going when they are not happy with the immediate boss or with the team with whom they are working, because their interpersonal skills and communication skills are not effective. Of course, patient experience scores go high, patients' feedback goes high, patients' remarks, reviews. Now, especially they go to the Google and they write reviews. And we all know the consequences of having bad reviews. So if as an institution, if you have a good image, automatically your patients are going to be loyal to you. They're going to stick with you. They're going to talk highly about you. They're going to recommend your institution to all others. And automatically there is enhanced safety and quality culture in the organization. So in nutshell, communication in healthcare is not just about niceties. The biggest problem with learning with communication is we think it's all about just good behavior. That's one part of it. Yes, we need to be cordial, we need to be nice, we need to be professional, we need to be well behaved because we are in a customer service sector. But at the same time, it is a therapeutic communication that happens between the doctor or the healthcare provider and the patient. So there are some protocols that we need to follow. We cannot just do the way we like. It's a clinical communication that happens between two healthcare providers where patient's information is being shared and handled between members. It's part and parcel of the overall treatment, and it's not optional. It has direct impact on the continuity of care, patient safety, and treatment outcome. I think these are the three major objectives of any quality healthcare. We want the continuity of care to be ensured, patient safety to be looked after, and we want the best treatment outcome for our patient. So communication has direct impact on all three. There are protocols available, which we are going to share, discuss in this program. But every healthcare professionals must know these protocols. They must learn these and practice them, imbibe them, and become good communicators. So there are multiple ways to learn and implement, like we are having it here. And similarly, hospitals can take initiative in, doing sensitization programs, skill building program around communication and handling difficult situations. So to end with my presentation, I want to share this study by Harvard, where they tried to understand the role and importance of communication and interpersonal skills. Studies suggest 85% of our personal and professional success comes from our communication and interpersonal skills. You may be an excellent clinician, but if you're not able to open a dialogue with your patient, if you're not able to win your patient's trust, if you're not able to make your patient comfortable, trust me, your patient is not going to be satisfied. Even an average clinician with excellent communication and interpersonal skills would outperform a clinician who has excellent clinical skills. So that is the role of, communication skills and clinical skills, because we are dealing with human beings, we are dealing with patients, we are dealing with suffering. We got to really understand the role communication and interpersonal skills play in this manner. So this is, in a nutshell, or in brief, or in detail, about the relevance and importance of communication in healthcare. Any questions about whatever we have discussed? We can spend 5 minutes in discuss. I know we have passed half an hour, but because we spent a lot of time in introduction, so I'm sorry for the, taking over more time. Any questions about what we have discussed till now?
You talked about the impact of giving information about enucleation and amputation. Do you think we should discuss these things with the patient directly? I mean, is it a good idea to give poor prognosis discussion with patient directly, or how to handle these things?
So, Dr. Puneet, we are going to have a full session on breaking bad news. So there we are going to talk about it at length. But yes, I would like to answer your question so that at least some curiosity is satisfied at this point. See, you have to first of all be ready to talk. Then it depends on situation. If we talk about legal terms, it is the patient's information. Without patient's rights, permission, we cannot even share with the patient's family member. But we very well know, if we talk about the Indian healthcare delivery system, it is the family who is the primary caretaker, and they are the one whom we normally communicate with. So legally, yes, it is just the patient who should be knowing, and without the patient's permission, I cannot share the information with the family. But at the same time, we know patient is not really in that right frame of mind to take a decision or understand. So again, you will have to take a call depending upon this situation. But whether it is patient or family, how do I go about? What is the right way of doing it? I need to know the protocol. How, in case if I see the patient is not ready, patient is going to overreact, or the patient is very anxious, or patient is depressed, patient may lose hope. So maybe you will have to take a call. No, we will stagger it. We will talk to the patient. Later, I need to talk to the family. So there's no one line answer that this has to be done this way. Although in legal terms, yes, it is clearly said it is the patient who should know first, and with the permission of the patient, we talk to the family. But then it will be depending upon the situation you're handling. But yes, talking about the issue is very important. Thank you.
Madam,
yeah.
Would you
Yes,
please spare me 5 minutes? I have to pick up my phone.
Yeah,
I have to attend an emergency
you
call.
can put
Sorry
the
for that.
on mute mode, and you can, yeah. We are otherwise also ending the session, but I want to just make sure that everybody has to ask if anybody has a question to us.
Ma'am, is there any benchmark for communication? Because as we see, whenever we talk to patients, there are number of people who keep changing. For example, if I think that I am a doctor, I talk to a son today, I talk to daughter tomorrow, I talk to some other third person day after tomorrow. So they keep changing, and we cannot tell them that, okay, only son, daughter, or someone should come. So is there anything, a kind of a framework which we can design based on which
absolutely
we can kind of do some kind of a benchmarking for
so
communication?
it's always a good idea. It's
Yeah.
always a good idea to identify primary caretakers. Actually, in the case sheet, if we can mention at a place, okay, this is the patient, the primary caretakers are these 2-3 people. It's always a good idea to build rapport with them, interact one-on-one in them, because this preparation you are doing for the rainy day.
Yeah.
Because if you have built rapport, if they have trust in you, if you have addressed their concerns, tomorrow when they will come to you, they will know that you are a good doctor, you listen, you talk, you address my concern. Even if I have to break this bad news that, okay, the surgery has gone wrong, or there has been some error in the patient care, the background work that I have done with the patient's family, that will save me. So therefore, I emphasize on doing your work. There's a message going on WhatsApp. I can sleep when the wind is blowing. I don't know if you have read that message. That, I mean, somebody who has done the homework. If you have done your fencing well, you are safe. Only thing is, if I have built rapport with the primary caretakers, if I know them one-on-one, if I talk to them, if I update them on a regular basis, 100% they would automatically be, they would believe that you haven't done anything wrong. And it's always good to communicate with them.
And I think it is also important that clinician along with the management is also a part of that discussion, so that they are all aware who's talking to them at any point of time.
Again, I think we are going to the difficult situation where we need to, have a difficult conversation. I think we'll talk about it when we take that as a topic. We'll talk about it. I mean, we will have a huge lot of discussion around it. Yeah. So any other question if anybody has?
In the same context that Mr. Vamshi Mohan just mentioned,
yes,
it would be a very good defensive defense before the court for the doctors to mention in the case sheet that there were several caregivers and there was not one person who interacted with the doctor. And this also posed the challenge to the caregivers themselves in order to put forth the communication. That would really save the doctors.
And also with whomever you are communicating or updating or explaining, always document in the patient's case sheet, date and time, sign, and also get their signature. And when we get this document signed, don't be rude, sign this, I've explained to you. I'll say, I've explained you about the patient's condition. I've answered your questions. If you have any more questions, I am ready to answer. I've documented this in the case file. I am signing it. Would you mind signing this document? So the attendant will be more than happy to sign it, because it's a cordial kind of a conversation. So even things like high risk consent, and we normally take that with the idea to save ourselves. The idea is we explain them, update them, prepare them, and then get the signature. They'll be happy to sign.
And if they don't sign, record that they haven't signed despite requesting.
Wonderful.
I'm sorry. I'm sorry. I'm trying to be a lawyer then.
Not at all. I'm more than happy that this input will really help all of us.
Yes,
this input will
can we have a video recording of the discussion with the patient?
No harm. Absolutely. I think most of the hospitals are practicing this now, but the patient has to be informed, because it has to be with the consent of the patient. We cannot record without the consent. Am I right, Mr. Mohan?
In our hospital, in our hospital, we do follow a system in ICU. Like we have a prognostication chart, like for like every day, on an everyday basis for the ICU patients only. Like the patient's party is, counsel about the status of the patient. And then from both the sides, signatures are taken. I mean, it is documented that the prognostication has been done.
Absolutely.
I think that also is a way.
I think as a protocol, that's perfectly all right. At the same time, the approach has to be positive. The idea is to help them know what is the condition, what is the prognosis, and in case if they have some questions and concerns, they need to be addressed, and then put the ball in their court to take a decision what they want to do. We'll be talking about it when we talk about the breaking of bad news. We'll be discussing. But you are right that yes, I mean, if we have that protocol, automatically you have an evidence of the communication that you have with the family members. Thank you, Dr. C. Any question? Dr. Shahrukh, you said something you want to talk about the amputation of?
Ma'am, I usually get into the situations when the patient needs an amputation. And recently also, 2 weeks back, there was a situation when there was a person, his hand got stuck in some machinery, and the person who he was working with, he was the only caretaker there. And multiple times I had to face a lot of people who came there, and one of the MLA also scolded me for that you are not taking good care of the patient. And but I kept on telling him that if we don't remove your arm, you are going to die, because it is going to create some sort of chemicals which will harm your health. So it was a very difficult situation. In 3 to 4 days, he just understood and just gave consent, and he said it by himself that please remove my arm, whatever you want to do. But it was a very difficult situation.
So Dr. Shahrukh, we will take this as an example, as a role play. You be the patient. Either I will be Shahrukh, or anybody else who thinks that they are ready to play the role of Shahrukh. We'll have this conversation and we'll see, because communication is not what you say, it is how you say. Losing a hand is not a small thing. So I have to first of all understand patient's plight and patient's perspective. And from that perspective, if I help the patient understand the need to amputate to save the life, that will help the patient understand that you want to save the patient for the patient's interest. We'll talk about it. We are going to have a long, discussion about these things. I'm glad that we have such cases which we can discuss as in the role play. We are going to take real life situations as role play and see how we have to strike conversation in such cases. We'll definitely take it. So I think Dr. Richa had put a question, can I leave? Because it's already almost like more than 3 hours. More than 3 hours. Should we close this session? If everybody. Thank you so much for actively participating and contributing to the session. This is what is expected. Only thing is the timings may go beyond 8 to 10 for you. I'm okay with this because my objective is to send you back satisfied. You have to see how comfortable you are to sit beyond 10 o'clock. But if everybody agrees, we can go on maybe till 10:30. Maybe we can add half an hour extra. Okay, you want to say something, Mr. Mehdi?
Ma'am, will we get the course materials like the today's sharing in this Zoom meeting?
This YouTube recording I will be sharing in the group immediately. You can see the recording once again for your benefit. And the discussion you have already had, so you know what we have discussed. Content I have already sent. I have emailed to everyone. I'm sure you also have that content with you.
And by this time, do we have any homework?
I will be no, not really. After session 4, I think you will gear up for your pedagogies.
Okay. So thank you very much. Thank you, everyone.
I will be sharing the feedback form. I'm not holding you now because I know it's very late. I'm sharing the feedback form to in the WhatsApp group. Again, it's a very short, brief, crisp feedback. Please give your feedback so that we can make our sessions better. Thank you. Thank you, everyone. Bye-bye. God bless you.
Thank you.